It's the second deadliest Ebola outbreak in modern history, already killing more than 1,000 people. Aid groups in the Democratic Republic of Congo say the situation is getting worse. In the past week, 27 cases were reported in a single day, the highest recorded since the start of the outbreak in 2018. A major obstacle in the fight against the deadly virus has been violence. The World Health Organization reported more than 119 attacks on health workers and their facilities. So, in the presence of security threats and the absence of resources, how can this killer virus be contained? Well, let's go to Geneva and speak to Tarik Jasarevic. He's a spokesman for the World Health Organization. Tarik, that's exactly the question. Attacks continue. It's getting worse. How do you actually tackle this?
Well, exactly. As you have said, the security has a major impact on the response to this Ebola outbreak. Every time there is a security incident, we are basically not able to go into community and provide services, which means that people who are infected with the virus do not receive care. They stay in a community infecting other people. Once we get back to that community, then we see a big increase in numbers because the virus was freely circulating in the community. So we need environment that will enable us to do our job, but we also need funding for that.
Okay, if that is possible, say tomorrow the guns go silent, all the attacks stop, what happens then? How quickly is it possible to contain the spread of Ebola?
Well, we have to understand that in this current outbreak, in half of locations where we had Ebola transmission, that transmission has stopped. So every time we were able to access communities, to engage communities in the way that they become owners of the response, it was possible. So what does it mean? It means that we have treatment centers that provide treatment to those who are infected, including new therapeutics. We have vaccination teams that freely go and offer vaccines to those who are considered at risk. We have teams who follow those who are considered at risk. So in the case they get symptoms, they are treated quickly and diagnosed first, then treated. We have teams that do safe burials in a community. And we know once the community is engaged, once community takes ownership of the response, we are able then to contain the virus, because at our disposal we have this time vaccine, we have therapeutics, we know vaccine is efficient, but again, if we don't have access and that lack of access is because of security, then none of these measures can be put in place.
The Lancet did some great research and it found that more than a third of people in the parts of Eastern Congo or Eastern DRC that were polled were suspicious of the whole thing. A lot of them believed that Ebola was made up, it didn't actually exist. There was some nefarious intent from those people who were trying to save them from Ebola, kind of similar to what we saw in Pakistan with the polio vaccine, right? Different sociology, but something similar. How much more difficult does it make it for you guys to do your job, given that so many people are suspicious of the fact that this is actually a reality?
Well, this is a key issue, really. We have to understand that although this is 10th outbreak of Ebola in Democratic Republic of the Congo, it's the first time in this part of the country. So these people have not seen Ebola before. That's also area with active conflict, where there's a mistrust between communities or between communities and authorities. And obviously there will be groups who will try to use the outbreak to promote their goals, whatever those goals could be. We need really to start from the beginning in every new location to explain what the virus is, to explain how it is being transmitted and what needs to be done. Obviously, there is always misinformation. Sometimes it is deliberate, sometimes it's not. But we really have to fight. So we use everything at our disposals. We have anthropologists on the ground. We have people whose job is to engage the community, to spread information. But we have to understand what are the grievances of the community. And there are big grievances in this region. This population is already traumatized by the conflict. So they tell us, well, look, we don't have a security. Why we would engage in a fight against Ebola? Or we don't have a strong health system. So why all of that just for one disease? So we really have to understand it and try to work with them and try to make sure that that they understand how bad it is, and also to understand that WHO will stay here beyond Ebola, that we will continue to help Democratic Republic of Congo in all aspects of strengthening the health system.
Okay, Tarik Jasarevic, great to have you back on the program. Let's say goodbye now to Tarik and bring in two new guests. In Goma, in the DRC, is Fidel Bafilemba. He's an independent research consultant and author of the book Congo Stories. And in Paris, we have AnneMarie Pegg. She's the clinical lead for epidemic response and vaccination at Doctors Without Borders in France. Good to have you both on the show. Fidel, is that at the heart of it all, what Tarik said? Lack of trust on the ground from so many people, which is only making this worse?
Well, this is a community that has been suffering crisis and especially armed attack for 5 years now, with a huge, massive presence of UN organizations, on top of which you have the UN peacekeeping mission called MONUSCO. So these are people who have been patrolling and doing literally nothing in terms of engaging the combatants and bringing an end to the security issue. So in that regard, on top of that, you have the political situation landscape, which is not helping, quite helping the situation. President Joseph Kabila, with the Electoral Commission, they literally sidelined the people in Beni and Butembo under the excuses of Ebola, while people were going to mosques and churches, going to schools and so forth. So I think all of this is culminating into building up mistrust from the people. But also, let's mention that, and as I have mentioned it before, that most of the NGOs, they have failed lamentably reaching out to the people. And I am sorry that even the approach that is being used, it's not that much effective, that it's being seen as Ebola becomes a business by individual peoples, by individual NGOs who are not trickling down the responsibility to community leaders as it should be required.
Okay.
So they can chime in.
Okay. AnneMarie, given that we've seen so many health workers killed and wounded in trying to tackle Ebola in Eastern DRC, has MSF taken note of that? Has it changed policy? Are they rolling back or are they still engaged? What's going on?
We are still engaged in North Kivu. It's been a number of years since we've been active in the region. We have been running projects in North Kivu and Ituri province for a number of years and continue to do so, and certainly have scaled up those efforts in response to the Ebola outbreak. It's true we're no longer involved in the actual treatment centers in Butembo and Katwa, where we were previously involved, but in other areas in North Kivu where we are working, we have attempted to put in place a more integrated approach. What has become clear and what has been alluded to by my two colleagues certainly is the fact that the approach has been very vertical and very focused on Ebola as a single disease, despite the fact that this is an area that has been historically suffering from numerous health challenges and weaknesses in the healthcare system. And what our approach, therefore, and perhaps it has been a little bit too late for us to learn this lesson, but here we are, that the healthcare system that already exists in an area, in the province, in the region, needs to be involved in this outbreak. It needs to be the place where cases are identified. The healthcare workers who are already active in the area and have earned the trust of the community need to be involved, and we need to support them, not the other way around. There needs to be an investment in the healthcare system, and investment in the healthcare system in terms of basic things like infection prevention and control and good clinical practices are actually going to go a long way, not only to reduce the spread of Ebola, but to reduce the spread of other communicable diseases and improve the health structure overall. So our approach has been much more of late to look at the existing healthcare system and look at how we can strengthen that in face of the Ebola epidemic, and how can the existing system better adapt to responding to the epidemic rather than a completely parallel approach.
Fidel, given that there's a terrible security situation coupled with the epidemic, is the central government incapable of stepping in and trying to do anything, and that's why we're seeing such chaos? Can they do anything even if they wanted to?
Well, they could do much. It's mostly a question of political will. If the security situation has been worsening in Beni and around Beni, including Butembo, it's mainly due to the lack of political will, mainly. Though, yes, there can be parameters of people out from outside and so forth. But again, this is the Congolese government not really doing its job as it should. So let's hope that Tshisekedi, who just stepped in, maybe he can do something as he has promised. But yes, I do agree with MSF that handing down the responsibility to the local communities, the existing structures, that's the way to go. Otherwise, people will remain suspicious because we have seen this number of huge NGOs and it doesn't make it, it doesn't help anything. Hand down to the people, sensitize those people, train them, and let do the job they can do because they're going to be more trusted than you guys.
Right. AnneMarie, let me ask you about our ability collectively to tackle Ebola itself compared to that period 2013 to 2016. It was horrible in Liberia, Sierra Leone, in Guinea. Are we much better equipped medically, scientifically, in terms of vaccinations, in terms of treatment? If all things being equal, and if the security situation was okay, are we really much better equipped at tackling Ebola?
I think we are. I think we learned a lot of lessons out of the West Africa epidemic. That epidemic also spurred a lot of research and developments within the scientific community. And I think that's something that can definitely be seen as a positive development. There are therapeutic agents that are showing promise. There's a vaccination that also shows a good level of efficacy. There's been a lot of advancements in terms of providing a greater level of supportive care to patients who are sick in an ICU level setting. We've made great strides in being able to provide that level of care. So I think there are a lot of things from a medical scientific perspective that are very promising. And we also know that for people who arrive in the treatment centers early in the course of their illness and who do receive this level of care, the outcomes for them tend to be better than what we've seen in other epidemics. So absolutely, things are moving in a good direction from a medical scientific perspective. Of course, the challenge of that is if nobody arrives in the center that's providing the care, then there isn't really a lot of good that's coming out of these developments. And so, as has been stated a number of times, a lot of the efforts that need to move forward now are those that allow a level of trust to be developed within the community, that people do arrive early and do benefit from these new therapeutic developments.
Right. Well, it's a worrying situation at the moment, but we wish the aid workers and the people on the ground and everybody involved all the best in trying to stem the tide here. For the moment, let me thank all of you, Fidel Bafilemba and AnneMarie Pegg. I thank you very much for joining us here on the Newsmakers.